I'm Damian Topp, the CEO of the PA Research Foundation here at the hospital. We are really proud to be associated with Mandate, with Triple M again. I prepared a slideshow, but I'm going to whip through it really quickly. The key things to tell you are that since about 7 o'clock this morning, it's nearly 10 o'clock now, there's been 5 men that have passed away from heart disease. 2 have had strokes and died. 2 have died from lung cancer. 1's died from other respiratory diseases, and in about 5 minutes, the first guy from prostate cancer would pass away. So compare that to women, the same time frame, it's probably about half the number of women have passed away. So we're certainly losing the battle of the sexes if you look at it from a purely physiological and medical way. So there's certainly lots that can be done. Our life expectancy is a lot less than women. 1 in 2 of us will be diagnosed with cancer. Every hour, 5 of us die prematurely, so of things that can be prevented, where there's only 1 disease in our spectrum in the last lot of diagnostic results that came out that women are beating men in, and that's pretty obviously breast cancer. Only a couple of men die each year from breast cancer. About 2,500 women die of breast cancer. Everything else, it's all the domain of the man, and there's certainly plenty we can do about it. Only about 60% of men actually go to the doctor and get a check. So at the moment, if you're a bloke, you're 1.5 times more likely to die than a woman. So plenty that we can do about it, and this is making a really good step in the right direction. The reason why we are more likely to die early is because we're more likely to eat fatty food, exercise less, drink more alcohol, smoke, use illicit drugs, take risk-taking behaviour, and less likely to talk to people. And certainly talking's been a big part of trying to curb a lot of these health issues. The top 5 killers, as I said: heart disease, lung cancer, stroke, prostate cancer, bowel cancer. 10 health tips: quit smoking, drink less alcohol, maintain a healthy weight, exercise more, eat a balanced and healthy diet, have an annual health check, which is what we're starting today, protect yourself from the sun, take some time out for yourself, drive safely and be positive. So most men are pretty scared of going to the hospital. I think we were discussing last night that with a couple of people that it's because men are too busy. I wouldn't like to try that argument with my wife. So it's more like fear going to the hospital. It's fear that something will show up. The thing that people need to understand is that the more people that are diagnosed with an illness or a disease, the less people die. So over the last 10 years, as the diagnosis of cancers have gone up, less people have died from cancer. We're now to a stage where we're trying to encourage more and more people to get diagnosed, because knowing that there's a problem there is the first step in treating it and stopping anything from happening. So today there's going to be a number of health checks that you'll participate in that you should get done every 12 months. There's a skin cancer screening with Professor Peter Sawyer and his team. Peter's just over here, the blue shirt.
His team is here.
His team is right near him. There's some other health checks: blood pressure test, body mass index, diabetes questionnaire. Diabetes is actually one of the growing epidemics, along with liver disease in our country. So as we had a more affluent life the last 10 years, diabetes and other cancers of the liver and liver diseases are growing, as is heart disease. Then there's a blood test. Now the blood test is a bit more complex. It's more than just the PSA. So I'm just going to ask Jake from our pathology area just to give you a quick run through on what the blood test is. Don't be scared. We don't take more than a couple of litres at a time. It's all good.
I suppose the main message is really don't be scared, because you have absolutely no reason to be scared. Our collectors are the best, that there are in Queensland. There's zero pain. They're only really taking, I think it's about 15 millilitres altogether. So it's like half a shot glass. So it's basically nothing. Now the ELFT, electrolyte liver function test, will effectively give you an idea of how well your body is metabolising things. It'll tell you, whether you're dehydrated or not. So it's a good measure of your general health. Your fats is basically a look at cholesterol, triglycerides, it can tell you whether you've got, cholesterol issues. And your PSA or prostate-specific antigen is a good measure of whether or not you need to have a proper digital exam from your doctor to tell whether you have any actual prostate problems. But just want to emphasise, guys, it's really quick. The blood test is really quick, really easy. If you've got one of these forms in your bag that you've been given, if you could take it out, start filling it out. Just your at the very top, your name, your address, and directly underneath the part where it says CSR, please also scan patient consent form, there's a part that says copy reports to. If you have a GP and you would like your pathology results to go to that GP so that you can follow up with them, just put in their details and we can pick them up and get those the results to them. But anyway, no pain. Thanks.
No pain's a good thing. I think it's important just to highlight that, those blood tests are really important, especially with things like heart disease. So it's more than just the PSA. I know from listening to Triple M during the week, at least one person in the audience doesn't have the issue of the PSA test and showing anything up to untoward. But the heart disease certainly is a test. And as I said, heart disease is killing 5 people every few hours in Australia. So it's really important. Now on your bags, you've got letters, which says the group that you'll be in to go around the health checks. When you get to the top of the stairs, so if you make your way up, maybe Group A will do 3 groups. Group A first, if you want to make your way up to the top of the stairs. If you did pick up a bag, if you haven't got one, grab one on your way out. And then Group B, if you can make your way out to the outside area in the courtyard, and Group C, you can just wait just inside the foyer. That would be great. So thanks so much, and I hope you enjoy yourself. And can I please just ask you to ask as many questions as you like. All of our health professionals here have the knowledge to answer all of your questions far better than me. So and far better than discussing it around the bar tonight. So ask the health practitioners. And just one last thing, if I could all get you just to join me in thanking all the PA staff that have given up their time to help you guys out today. Thank you very much. Off you go into the wide world.